Hello everyone, a warm welcome to all of you. Today we are going to discuss a few remedies for worm infestations which are very useful in our homeopathy. So, worm infestation it's a common problem in our country and the concerned homeopathic medicines we are going to discuss today. But before that, there is something important like this video is made for BHMS students, interns and doctors. If any non-medical person is watching this video, then I would like to make a humble request not to self-medicate yourself or your loved ones. Always consult a registered homeopathic practitioner before consuming any homeopathic medicine. So, let us start. So, today we are going to discuss a few remedies for worm infestations, and I am myself Dr. Madhushri Datta, PGT, Department of Materia Medica. Today we are going to discuss aconite, argemone, arsenic, Artemisia vulgaris, Caladium singuillum, cicuta, cinna, ignatia, indigo, quassia, sabadilla, spigelia, stannum and teucrium. So, first that we are going to take up is number 7 in this list, cinna. Because cinna is a medicine that comes to our thought. In fact, this is the first thought that comes to our mind when we think of worm infestation and the corresponding remedy in homeopathy. So let us begin with cinna here. Common name worm seed, family Compositae, active principle or alkaloid santonin, central point of action that is the abdominal ganglia. This is very important point to be noted that cinna acts on the abdominal ganglia. Reflected nervous impressions are also there. Mainly or principally the brain and the spine gets affected by the action of this medicine, but that is the secondary. The primary action of cinna is the abdominal ganglion. Next is the etiopathogenesis of cinna. I've tried to describe the etiopathogenesis of cinna. The primary symptom, as you can see, the abdominal ganglion itself, but the reflected impressions are over the all parts of the body. Principally, the brain and the spine gets affected. Coming to the next part, that is the action of the cinna, how cinna acts. So, as I told you earlier, cinna so far corrects the abdominal organs. As long as the worms are present in the alimentary tract, cinna comes to rescue. Cinna corrects the abdominal organ, tones up the abdominal ganglia, that the mucous membrane of the alimentary tract pours a normal secretion, and the worms no longer get a suitable environment to survive in the abdominal tract. So they die and they are excreted or expelled out. This is how the use of cinna, or this is the action of cinna. So this is how it acts when the worms are there in the alimentary tract only. This is very important to note that cinna is useful not for all conditions of worms but only when they are present in the alimentary tract. I know I am repeating this too much, but this is worth repeating also. Now, as I told you, by the reflex action of the cinna, the brain and the spine gets involved. So we come to see the various features of that involvement, like violent spasms, convulsive twitchings, jerking of the limbs, and in fact strabismus is also present. For those of you who don't know what strabismus is, I have a picture for you. This is how the strabismus eye look. It is also known as the squint eye. This is actually the abnormal alignment of the eyes. There can be many etiology of strabismus, one being injury to the nerve or dysfunctioning of the eye muscles. So this is how the person looks. In Bengali, we have a term like tera, what you called. You must have heard of it. So this is how strabismus or the squint eye looks, and this may be produced by this medicine. Now let us see the various other symptoms, and first being the phase of Sina. Phase of Sina is very important to note. The face is pale even if there is fever. Ipecac is also a medicine that we can think of in this condition, but the basic point by which you can differentiate here is the nausea, which is a very characteristic of ipecac and is always present in ipecac with all the complaints. The patient will have a nauseating tendency in ipecac. Whatever complaint the patient may have, nausea will always be there, but that is not there in Sina. This is how we can differentiate it. So with the pale face of Sina, there is dark ring under the eyes. As you can see in the picture also, the face is pale and there is dark ring under the eyes. If you find the pupil of Sina child, the pupils are dilated, right? The child grins with the teeth during the sleep. Okay, the child grins its teeth during the sleep. It also picks or boards the nose with fingers. The sleep is restless and is often attended by crying. So these are all actually the general actions of Sina that I told you just now, along with the phase of Sina. That the child grinds its teeth during sleep, also that is associated with the canine hunger. This gives a perfect picture of the drug. Picks or boards at the nose with the fingers tips. Sleep, the child is restless, is attended by crying out. Right. So now let us see another group of remedies for worm. Now my point or my question is that if Sina comes to be so miraculous a medicine for worms, then why do we need another group of remedies? As I told you, or as I had repeated a point earlier so many times, that Sina is useful or Sina is indicated when the worms are present in the alimentary tract. But now suppose if these worms they appear about the anus and get into the rectum, then Sina is of no avail because the symptom caused by them are not the symptoms of Sina. That time we have this another group of remedies like aconite, especially when the child is feverish and cannot get sleep. That time we can think of aconite. We can think of ignatia when the child is simply much excited. Right. We can think of indigo, especially indigo, when the convulsions result from worms. Right. So when the convulsions result from worms, we can always think of indigo. This is a very good medicine for that. Right. Along with that, if all the above medicine fail, then you can think of another medicine, that is quassia. Right. Quassia presently presents with symptoms like there is atonic dyspepsia with gas and acidity. This medicine you can find in Borix materia medica. Right. So if the patient is having like atonic dyspepsia with gas and acidity, if the tongue of the patient is dry or with brown sticky coating, if there is cirrhosis of liver with ascites, and all this occur after like this worm infestation infectious disease, then you can think of quassia. And especially when all these remedies fail, then also quassia can be a very good remedy that you can think of. Now coming to another very important point, that is caladium. In case of caladium, see, this is the best remedy in case of little girls, especially as you can see the direction in the picture. The worms, they will travel from perineum into the vagina. So you can see in the diagram also, the worms, they are traveling from perineum to the vagina, and this traveling, this will cause some irritation. This irritation will excite masturbation. Right. This is a place when you can think of caladium. Now moving on to another group of remedies. Argemon mexicana. Argemon mexicana have been used for the expulsion of tapeworm. It's a very good medicine for the expulsion of tapeworms. It is actually a variety of poppy seed that grows in Mexico. It causes cutaneous eruption also. Juice of this plant is collected especially. Then we have thymol. This is another rarely used medicine found in boric, and they are also specific for hookworms. We have another medicine, Chilon gabla, that is a round anthid worms. It is an enemy to every kind of worm infestation in the human body. You can use this medicine. Another very important medicine is Felix mass, especially when there is worm symptom. Along with that, if the child is or if the patient is having constipation, then you can think of Felix mass also. Now let us see another medicines like Santonium. Sometimes cures the worm affections when Cinna seems indicated but fails to cure. Similar symptoms are there for Teucrium and Spigelia also. Although I'll explain all the medicines one by one, and this reference is given in your ALS keynote only in the relationship of Cinna. Next point is Teucrium marum. Now, Teucrium marum, it is having, the patient will complain of excessive itching in the anus, itching of the anus and constant irritation in the evening in bed. This will be the symptom. Okay, there will be nightly restlessness. The patient will not be able to sleep at night, especially due to the itching of the anus. This is a very, very common symptom that you can find in your patients. So there will be a crawling sensation in the rectum after stool that you have to get from your patient. Next in the list we have Stannum metallicum. Again, Stannum metallicum is a very, very important medicine that is indicated for worm infestation. It is having a very, very important symptom like epilepsy for worms, especially with sexual complications. This is a very, very useful symptom of Stannum met. There will be actually the presence of worm in the intestine that will cause reflex abdominal irritation obviously, and those reflex symptoms will ultimately trigger all the other bodies, the brain, the spine, and finally the patient may land up in epilepsy. There will be convulsions present from the irritation of worms. There will be disordered digestion or dyspepsia with which the patient will present to you. There will be nausea and vomiting in the morning. Also, if you look at the face of Stannum met, it will be pale, it will be sunken, it will be like dark ring under the eyes. Next, we will see Spigelia in worms. Spigelia is also again a very, very important medicine for worms. Abdominal irritation causes strabismus. I told you earlier what strabismus is. So, if there is abdominal irritation that finally leads to the reflex symptoms, finally damages the nerves and the muscle dysfunction occurs, then the patient may land up in squint eye or strabismus. I told you the etiology of strabismus also obviously in short in the previous slides. Patient here feels fainted and nauseated in the morning or on waking up, and there is hunger that is relieved by breakfast, and all these symptoms also like nausea in the morning, the hunger, they are relieved by breakfast. There is a special type of colic in Spigelia, that is colic worse above the navel. Stool consists of mucus, feces and worms. So when the patient will come to you along with their mother or parents or anyone else, that person will tell you that when my child is passing feces, when my child is passing stool, we can find worms in that. You can think of Spigelia in that case if the above mentioned symptoms are also present. Now let us see another very useful medicine, that is Sabadilla. Sabadilla for worms. In case of Sabadilla also you will have a nausea and vomiting like the previous medicine, but it is associated with a peculiar type of colic. What peculiar colic? As though the bowels were being whirled like a wheel. This is how the patient will present the symptom, as if the bowels are like being whirled like the wheels. Coming to another very important remedy like cicuta virosa. Cicuta virosa, there will be congestion in the base of the brain and medulla oblongata, right? This can be indicated when the patient will complain of congestion of the brain and medulla oblongata. After that, at first, the patient is rigid with fixed staring eyes. Staring eyes, fixed staring eyes means what we say in Bengali that chokher polok porche na. Fixed. There is bluish face and there is frothing at the mouth. I suppose everyone is getting or being appreciating the point of what is frothing at the mouth. মুখ দিয়ে ফেনা ফেনা উঠে যাচ্ছে. And there is unconsciousness, there is loss of consciousness. So this will be first that this will occur. Why? Due to congestion in the base of the brain and medulla. Next, what? After this, the patient will undergo a shock, series of shock from head to body. How the jaws will be affected due to it? The patient will have locked jaws. Locked jaws, the patient bites the teeth. There will be spasms followed by profound exhaustion. After the spasms, the patient will be profoundly exhausted, tired. Right. So the reference of all these things are taken from Borix Materia Medica, of course Allen's keynote, and also Clinical Materia Medica by E. A. Farrington. Thank you for watching this.